Hello class, this is my case study presentation and this is going to be on depression. The case I'll be presenting is about Hope Johnson, a 26-year-old Latino lady, an elementary school teacher. She came to the clinic with complaint of feeling very sad and emotional. She states she noticed that she cries easily now, and this has been going on for over 6 months. Hope noticed these feelings the week her husband left her and their 3-year-old son. Sadness is aggravated when their son starts crying and begging to see his father. Very emotional. The symptoms are relieved when she's around friends, family, and when involved in church activities. Hope loves to listen to gospel music. She states it uplifts her spirit. She's 7 months pregnant. She's not happy that the father of the children has left them. She admits to mild anxiety as well. She has support of friends, family, and church members, and this is keeping her going. She admits to prenatal care. Hope made it clear that she does not want any antidepressant. She was concerned to discuss her feelings or mood with the clinicians because of the medication issue and the stigma. She denies feelings of hopelessness, denies suicidal and homicide ideation. She states that her feelings and mood are not affecting her job nor her activities of daily living. She is gravid 2 para 1, no complication with pregnancy nor the delivery of the first child. The first baby was full-term and a boy. Hope has a history of childhood depression. She denies any other childhood illness. Her immunizations are up to date. Father and mother are alive. Mother has a history of diabetes and depression. Father has prostate cancer. Her mother and sister are alive and well. Hope lives in an apartment building with her son. She denies any form of illicit drug use, no alcohol or cigarette use, no second-hand smoking exposure. She stays to still enjoy time with family and friends. Hope is not into any regular exercise, but she loves to take a walk once in a while with her friends. She takes only prenatal medication, no known medication, food or environmental allergy, no abnormal review of system this visit. She is well dressed, cheerful and cooperative. Her vital signs are within normal limit. No crying, no apparent distress noted this visit. No signs of panic or phobic disorder. No sign of post-traumatic stress disorder. The mini-cock test was normal. No abnormal physical exam finding. Everything with Hope today was okay, excluding the glucose level that was slightly elevated. The differential diagnosis: depression, anxiety, hypo or hyperthyroidism, post-traumatic syndrome. The diagnosis is mild depression and anxiety, the two jolly friends. The rationale for diagnosis: going back to the other slides and the history we've gathered, we know all that the patient complained, and these are the list, and that's why we've been able to come up with the diagnosis of mild depression and anxiety. We've been able to gather the history from the patient. We've made our diagnosis. Now we want to treat the patient, but we remember is evidence-based practice. So these are some of the things we were able to gather from literature to be able to back the treatment and the diagnosis up. We see that depression rate is just increasing, and we just want to do something to bring this down so that it doesn't continue like that. And we've been able to see that pregnant women may stay away from seeking mental help due to the risk associated with antidepressants. And that was the problem our patient had. Many patients are running away because of the stigma. So we need to do something so that our patient will be comfortable to come and seek help when they need it. It's been shown that it is very important to assess our patients' belief about their mental health issues. This will help to understand how compliant they will be with the management plan. Imagine if we were to prescribe antidepressant to Hope, she wouldn't have taken it because she did not want anything like that. So we want something that will make us happy and make our patient happy and help them to be compliant with treatment. It's been shown that type 2 diabetes has a role to play with depression. So it's important for us to monitor our patients, monitor their glucose level. Hope's glucose level today was kind of elevated. So that's a risk factor we need to continue to monitor. It's been shown that parental depression is a risk factor for development of childhood depression. And we remember that Hope's mother has depression. Hope also has history of childhood depression. Also in this literature, importance of exercise and the role it plays in the treatment of mental health was reinforced. So it's important to encourage our patients to be active. It's important to know that treatment of depression is not a one-size-fits-all. We want to look at the severity of the case. We want to look at the patient in the picture and the condition of that patient. With Hope, she's pregnant. There are some things we cannot do with pregnant women. There are some treatments we cannot give them. She does not want any medication. So with her case, non-pharmacological approach is the way to go. We continue with her prenatal medication and for her to follow up with her OBGYN doctor. It's very important for Hope to be monitored for postpartum depression because of all that she's going through. And she has to maintain positive friends to surround herself with things that will make her happy. Education was given to Hope about SSRIs and pregnancy because we never know along the line she may need to take the medication, and this will help to allay the fear that she's having and help with compliance. She's to follow up with the psychiatrist if symptoms persist or get worse. She's to report feeling of hopelessness, suicidal or homicide ideations immediately. Patient is to keep up with her primary care physician for monitoring of A1C due to the elevated glucose of today. She's to take part in regular exercise for at least 30 minutes a day as tolerated. In conclusion, as clinicians, we can work together to help our patients with depression before it gets way out of hand so they don't kill themselves. The rest of the slides are references.